Welcome back. We were talking heroin addiction, the new epidemic. Attorney General Mike DeWine calling it that within the last couple of years. In fact, a couple of statistics we threw out a couple of weeks ago when we discussed this here on the Roundtable. 4.2 million Americans over the age of 11 have tried heroin at least once. That's a statistic from 2011. Easy to access, it's cheaper, more potent, and as a result, you're seeing more overdoses here, not only in the country, but in the state of Ohio. We were talking with Tom Hosler and Jim Fritz, superintendents for both Perrysburg and Anthony Wayne. Thank you for being here. Awake Executive Director Amy Barrett also here on the Roundtable this afternoon. Jim, I asked the question of Sylvania, I asked the question of Perrysburg. Suburban districts being targeted as far as heroin is concerned. Anthony Wayne, have you had to bust any kids related to heroin?
At this time, no. But we also understand that based on what we're hearing happening in the Cleveland, Columbus, Cincinnati area, we know it's just a matter of time before this movement is going to move into our communities. We already know it's in our communities, but into the schools potentially as well. I think it's time for us as a community, the Toledo area, to come together and work on solutions, work to help provide the message, not just about heroin, but drug abuse.
We talk about government getting involved, and obviously you guys down at this summit forum in Columbus a couple of weeks ago, and you saw John Kasich there, and also Attorney General Mike DeWine. Start Talking is the name of the incentive that the governor has started. Amy, Start Talking, meaning at home?
At home, yeah, start talking at home. Tom hit on, they gave the statistics of 50%, and I believe that that's probably a very accurate statistic.
Give that stat again, 50% what?
50% of kids won't use if you talk to them first at home. So we need that message at home. I think it's unfair for the community to rely totally on the school to provide that message. Certainly the school can play a role in that message of not using, but it's important that parents become involved and are talking to their kids, and at a young age. I think people are thinking they need to start talking to them in maybe junior high and high school, and the statistics are starting to show that that conversation needs to take place.
Before we started here today, we talked about the Say No campaign, which we were familiar with, of Nancy Reagan back in the 80s. And Tom, when you look at resources that are available, obviously, I mean, we had you guys in the news, you're looking at levies coming up, same with Anthony Wayne here soon. And when you talk about the resources that are available to a school district to take up another cross to bear, obviously, to try to help kids out. How do you do it? How do you juggle this as well?
Right. It's a challenge because our mission is to educate students and prepare them academically for their future. So drug abuse obviously can be a great impediment to that. So it falls on us. The other thing that we know is we have 5,000 students in one place at one time.
Right.
So we know we're one-stop shopping where they can get access. It's the one thing that we understand is it takes a systematic approach to address this. The get everyone in the gym and talk about a bad experience that somebody had and then send them back to class, we know that's not effective. So you need to take a look at what you're doing at every grade level, what message you're sending, and how are we helping to support each other in that.
So it's got to be more than an assembly.
Yeah, and then I think a lot of people think, well, we had an assembly, so we have a drug prevention program because we had that speaker come in. No.
And 13 ABC was out there to cover it, so obviously it's working.
Right, and we instituted drug testing in our district, and people are, well, that's it. That's not it.
Yeah.
I mean, it's one piece. The DARE programs, and I know you guys do a great job with that. That's part of it. Having an SRO, we just were fortunate to get one. That's part of it. So it's all these pieces, and then partnerships with agencies like Awake.
So is visibility an issue as well? We did a story a couple of weeks ago, Monroe County the state of Michigan putting up billboards all around the area, making sure that people know the message is out there. Is going back to putting posters all around the school, if those aren't up already? I mean, is that the answer, making visibility one of those things?
I think the answer that we were hearing in Columbus was the first step, one of the first steps is to start talking and have parents talk with students and children. I have community members talking with students and young adults, as well as we know this is a community issue. We have young adults that are graduated from our K through 12 system, maybe in college and or beyond that, who are having drug issues, and specifically to heroin. I think there's been a number of reports recently that talk about the fact that there is a significant issue in this area of heroin use and overdoses due to heroin. I think one of the reports I saw from last year was that Toledo Fire and Rescue responded to over 375 overdoses. And so what can we do as a community as a whole to come together, start talking about this issue, and try to help everyone who has this issue and try to move forward in a positive way?
And I think just to piggyback on that, we dedicate a portion of our operational funds to have a drug counselor on our staff to help with that. That's taking money away from other programs to address that. And I'm sure as we begin to look at those kinds of things that are required and needed, that it gets kind of put on the schools that, well, you guys take care of that. And then that's money that, well, where do we spend those dollars?
Right.
So I think there's a slippery slope that the schools will take care of it. They'll be the point, but it's up to us to find the dollars to do that. The start talking is just, there's no money involved.
There's no money involved in it.
But, and that's attractive and it's effective, but also what do you do for that student who does come to the counselor's office who says, I have a problem?
Yeah.
One of the things we've been able to work with this year, and the Anthony Wayne School is partnering with an organization who will come in when principal would call and say, I have a student that's, if they can't get to counseling, because a lot of times maybe they want that additional counseling, but they don't have the support at home to get to that counseling. And we've been able to bring those individuals in to meet our students on their ground.
Let me ask this, and this is a hard question to ask, but you've got you said assembly's not effective. It's got to be more than that. You look at prom season. We always do. We go out and we cover the mock crashes, but they've become an annual event. So have they lessened the effect for students? Tragically, you have a group of parents, Ottawa Hills parents, who are going school to school talking about alcohol addiction because they lost their son. What is it going to take? Is it going to be a slap in the face, just an unbelievable death of somebody from heroin to wake kids up?
I think it's all of these things that we just mentioned are pieces of the puzzle that need to come together to provide resources to our youth, to our community members that are addicted to these unfortunate drugs. And we all need to come together and work on a solution to this issue.
But even before the addiction problem comes into place, is getting those resources together before we hit addiction. When we hear of kids experimenting with these things, that's the time to intervene, not wait until it's an addiction.
Time about 15 seconds.
Yeah, those assemblies and people sharing those personal stories are part of that systematic. There is a role for that. But if that's the only thing you're doing, because I know with the guest speakers that the family that you mentioned, the follow-up conversations that those inspire, those are helpful. So
we appreciate so much. Hard conversation, but needed to be had right here. Stay with us. We'll be back right after this.